Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day and that everything is going well. And good morning, Maria and Peggy. And I'm enjoying my vitamin C this morning. Colleen, Denise, Andrea from Nouveau Brunswick, and Sandy. Let me know if everything is good, the sound, and Marianne and Colleen, you guys are great. Jeanette, Maria, and Marsha, John, our friend from Elgin, Illinois, Linda, and Jerry from Nouveau Brunswick. Kristen, good morning to you, Kristen. Nick, how are you this morning from our staff? Diane Brière, bon matin, toi aussi. Joanna, Dave, good morning to you. And Patricia, Beth, how are you? Another Andrea from Niagara Falls. Susan from Florida. You guys are great. Thanks for coming on. Big crowd this morning. We're going to go, it's question and answer Friday. Good to have you on. Annette, Martine, great. Marion, Bonnie, you guys are great. Thanks again. We love you. And okay, I'll put down my vitamin C this morning. Nellie, how are you? I'll come on and say hi to you afterwards too. Emily, hey, Joy, Yolande, I was waiting for you, Yolande. Here we go. Okay. Bonjour. Let's get going, and we got lots of questions this morning. Okay, Dr. Martin, what about varicose veins? Yeah, they're no fun. There's no magic getting rid of varicose veins. Okay, I mean, surgery, stripping them, and this kind of thing. There's no magic supplement. The best I find, and people have had good results with varicose veins, and whatever opens up, nitric oxide helps for circulation and, you know, opening up the little valves in the veins to push that blood. Navitol, pine bark extract. There's nothing better that'll elevate your nitric oxide better than that. B12 too is good for nitric oxide, so you know, if you're low in B12, take some red meat or whatever, okay? So, good question. Stephanie's asking about what are my thoughts on seizures in infants. Well, I talked about this yesterday. We talked about the 100-year anniversary of in 1921, okay? This was yesterday's topic. We talked about the 100-year anniversary, and one of them was the discovery of insulin. Not the medication insulin, but they've actually discovered what insulin, the hormone, and what it does. They didn't know everything about it, but they discovered that. That was in 1921. The other thing in 1921, this is how old the ketogenic diet is. 1921 is when they discovered the ketogenic diet for seizures, epilepsy, seizures. So I highly recommend that. That's why the reset is so good. Look, you can get into ketosis without doing the reset because you can eat about 20 grams or so, maybe up to 50 grams of carbs. But I know that sick kids, for example, still use the ketogenic diet. Sick kids in Toronto still use the ketogenic diet for seizures. So what's the connection? What's the connection? Why is ketosis good for the ketogenic diet? Well, it's because of the burning of the ketones in the brain. It's a different fuel. And there's, like I said, go back to 1921. It's a 100-year anniversary of the ketogenic diet. 100th anniversary of, and they never linked, by the way, insulin and the ketogenic diet in 1921, but both were discovered. Now, it's incredible, right, when you think about it. So ketosis, there's ketosis and then there's ketoacidosis. They're two different things altogether. And that's where the confusion comes in with doctors who don't know much about nutrition. Oh, don't eat too much. You don't want to go into ketosis because they're thinking of ketoacidosis, which is deadly. You don't want to go into ketoacidosis. That's when your body literally is starting to consume itself. It's at the end stage of life, and for a diabetic, that can happen. And you'll hear it even on the commercials on TV. Well, be careful for ketoacidosis when you're lowering your blood sugar too much. But that's not ketosis. Ketosis is when you lower your carbohydrates and your body has no choice but to, if you don't have carbs to burn, your body has got to, your body will take a fuel like fat and protein and burn that. That's what ketosis is. It's just a changing of fuels. I'll just remind you about the reset. The reset is not a ketogenic diet per se. It's not. You're not eating any carbs, but it's not a ketogenic diet per se, okay? Because ketosis allows you some carbohydrates. Everything's keto today, okay? It's very famous, and I'm not against it. But there's a lot of foods there that are not full of nutrition. They're just very low in carbs. I'm a full of nutrition food guy. That's why my choice is eggs, meat, and cheese. There's a reason for it. It's because it's nutrient dense. Your cells are getting the nutrition that they need. That's why I choose that, okay? So good question. Seizures. Janice asking about high red blood cells. Okay, there's actually 3 questions I'm going to answer here. Janice is asking about why would I have a high red blood cell count? Pauline is asking, why would I have a low red blood cell count? And Donna is asking about ferrous glutamate that she's been on for 20-something years, okay? And I'm going to answer all 3. So let's do that. You can have a high red count. What do red blood cells do? Okay, just to remind you. Red blood cells are FedEx trucks on the highways of your blood vessel. They're bringing you oxygen because in the middle of the red blood cell is hemoglobin. What is hemoglobin? It's Velcro. Hemoglobin is like Velcro, okay? So every time you breathe, your red blood cells go through your lungs and the hemoglobin, the Velcro, attaches to oxygen. Okay? So, red blood cells you can't live without. Okay? When the Bible says the life of the flesh is in the blood, remember, go back more than 100 years ago, but let's go back 150 years ago. They used to take blood out of you when you got sick. Doctors thought, well, your blood is poisoned. Let's take it out of your body and see how you do. Well, they should have read the Bible because the Bible says the life of the flesh is in the blood. So what do they do now if you get sick? They give you blood, right? You get a transfusion of blood. So if you have a high red blood cell count, why would you have that? Well, it's because you're not creating enough oxygen, so your body's smart. In the bone marrow, you'll create even more red blood cells to make up or try and make up for the lack of oxygen. So there's something, possibly with the lungs, if you have a high red count, possibly with the bone marrow. I've seen it even in anemia, where you have a high red blood count. High red blood count or low red blood count, both of them are not normal, and sometimes caused by the same thing. Now, low count, generally, when you have low RBCs, you're anemic. You're anemic. You know, and women suffer from anemia a lot. They don't even realize it a lot of times. I used to have patients come in and I would just look at them and I'd say, you're anemic. They go, nah, nobody said that. I'm telling you, you're borderline anemic. You don't have enough red blood cells. And a lot of times that can be, and Donna is asking about the ferrous gluconate. Okay, so you're taking iron. Okay, you're increasing your red count that way. Well, that's all right, but I always say blood is more complicated than that. You know, for a lot of people, they're not getting all the nutrient dense. This is why I like steak, guys, vitamin S. It's got heme iron, Heme, unlike any other iron. It elevates your ferritin. It elevates your B12. B12 is a key in the production of red blood cells. It's a key. So I look at more than just, ferritin. I look at more of their iron, the B12. I look at all of that because a lot of times they're not getting enough red meat. A lot of people avoid that today. Well, who asked the question? I can't, let me see if I can find it. Oh yeah, Brigitta. I might have, I think it's Brigitta that asked about red meat. And they're talking about, look, there's a lot of stuff, okay? Let me just straighten this out a little bit. There's a lot of stuff on the internet, okay? There's a lot of stuff on the internet. And repeat. Look, we don't live in a perfect world, so you have to understand, I'm going to speak in generalities. Is there better cuts of red meat and organic and this and that? For sure. For sure. But Brigitta, you brought me a question, like you wanted me to comment on, it's carcinogenic. Red meat is carcinogenic. Can I give you the answer? Steak, cancer hates steak. Now, that goes against the grain. I understand that. People don't like, some people don't like that. Vegetarians, vegans. The other day, we were told by Bill Gates that all of us should be eating synthetic meat instead of red meat and for the planet. Well, you know what? I don't buy it. I don't buy it. Poor cows. There's more dogs, there's more cats, there's more horses than there are cows. Why don't they ever talk about them? Cats and dogs eat a lot of food too. What are you going to do? Feed them a vegetarian diet? They can't live on that. They need meat. He didn't talk about dogs and cats. Just cows. Poor cows. I'm here defending the cow, okay? And the cow is the one that needs to be a vegetarian. Because you see, a cow they make cellulase, okay? They eat grass, okay? They eat grass. We don't eat grass. They eat grass. Because they have an enzyme to break that grass down. They have 4 stomachs. I always tell my patients, You're not a rabbit, and you're not a cow. You don't have cellulase. You don't make it. Am I telling you never to have salad? No, guys, I'm not saying that. But don't think you're made to live on that. You're not. The proteins in there are not sufficient for you. The amino acids in the vegetable kingdom is not sufficient for you. It's sufficient for a cow, but not for you. It's not as sufficient for your cat. It's not sufficient for your dog. And it's certainly not sufficient for you. Now that's controversial today. Why is it? Because I've said it to you before, it's an agenda. It's not science. Like when they say follow the science, they don't mean it. When Bill Gates travels around in his jet and lives in a 66,000 square foot home, well, good for him. But why is he like, when did he become a guru in nutrition and saying, we got to eat synthetic meat? Can I tell you something again? Don't touch it with a 100-foot pole. Don't feed it to your dog. Synthetic meat, most of it is crap. It's soy-based. To me, it's, if, you know, and Brigitta's saying, well, red meat. No, you want to know what cancer is? Cancer is in a Beyond Meat. That's where cancer is. I look, guys, I realize that people have their own opinions, and even my colleagues, many gurus, you know, that teach nutrition, they buy into it. But they weren't taught that in school. Where do you find B12? Day one of clinical nutrition, okay, in my PhD. Day one. Where do you find B12? Red meat. Okay. Where do you find heme iron, the best iron in the world to absorb? Red meat. Where do you find 22 complete amino acids? Plant kingdom or animal kingdom? Animal kingdom. I'm sorry, guys. It's the truth. What can I tell you? It's not carcinogenic. Now, you know, I know there's chemicals, there's, you know, like, there's hormones, and it's you know, it's almost completely unavoidable. But you're better off eating a piece of meat than having flour of any kind. You're better off having bacon in the morning than having oatmeal in the morning. But Dr. Martin, there's nitrates in the bacon and blah, blah, blah. Yeah, I know it's not a perfect world, maybe, but I'll tell you, it's still a lot better. Because the biggest problem today in society is insulin. It's the number one problem. We talked about that yesterday. It's the numero uno problem. Not the virus, not the climate, not the whatever. It's insulin. It's food. And we're carboholics. And I'm sorry. You can eat from the vegetable kingdom as long as you eat from the animal kingdom too. Okay? God gave you two kingdoms. Animal to eat and plants to eat. Fruits and veggies. Yep. But when you have trouble with insulin, which is the number one problem, then you gotta, look, I'm not saying eliminate. For 30 days I want you, because I want you to fix your insulin resistance. Okay? So, anyway, I know I get blowback. I know every day I get people pushing back on some of my statements. Guys, I'm not apologizing for the truth. And the proof in the pudding is when people eat properly and they see what happens to their bodies. The testimonies are unequivocal. They are incredible. They are, and look, it's protein, protein, protein. Complete proteins. Surrounded by fat and cholesterol. That's how your body thrives. So you go, oh, Dr. Martin, I like avocado. Good for you. It's good for you. I didn't say, but you take avocado and you take pork, you take bacon and avocado, and what's the difference? Your body doesn't know the difference except you're going to get more protein. I mean, the fats are the same. Everybody likes avocado. You talk to my guru friends. They love avocado. Oh, avocado, it is fantastic. Olive oil, it is so good for you. Olive oil, the Mediterranean diet. And I go, okay. What is olive oil? What makes it so good for you? Oh, oleic acid. Okay. And what's in bacon? Oleic acid? Yeah. Avocado. It's got 6 fatty acids. And bacon's got 6 fatty. Did I tell you can't have avocado? No. Well, you can have it, but not on the reset. Okay? Anyway, avocado's good. Okay? You get what I'm saying, guys? Do you get what I'm saying? Do you think I'm going to move off that? Nope. I'm not moving on that. Because that's just science. I mean, science is always, we're learning new stuff in science every day, and that's great. But guys, this is the truth. Man, am I ever getting sidetracked here? Okay. Mara is asking about plantar fibroma, and that's just a little scar tissue underneath and you get a little bit of a scar tissue underneath the plantar, the tendon. Roll a ball. I like rolling a ball, manual therapy. Make sure you got good arch supports, because a lot of times with feet, it's just the arches, okay? You might take some inflammation formula just to help with if you got real tendonitis in there too, and just to get that inflammation down. But you gotta do some manual therapy, okay? Joey's asking about chromium picolinate. I love it. I put it in our insulin formula. Insulin Balance has chromium picolinate, and about 5 other of our favorites for balancing your insulin. We don't talk about that enough. That's a great product, by the way. Barb is asking about platelet-rich plasma for damaged cartilage. Well, I've read about it. I don't know. It hasn't been like, I've seen stem cells used for damaged joints and all that, because I've had patients that had that done. Platelet-rich formula, like adding blood to it. It sounds really good, but so far, at least from what I've seen, or at least the feedback I'm getting from patients, it hasn't been dramatic, okay? But I'm not against it. It hasn't been dramatic. It's not like it's gonna, you get brand new cartilage and everything's good. Nah, if it was working really good, people wouldn't need wouldn't need joint replacements and things like that, which is, by the way, an epidemic today, okay? Really good questions. Kelly is asking about, she gets her blood pressure goes up when she takes probiotic. Now, I don't want to use the word, okay, that I used last Friday. I got into trouble with it. So I'm not going to, you're unique, Kelly. Okay? You're unique. It's not common. Okay? So I just wanted to tell you that. If it happens to you, and if it only happens temporarily, by the way, look, probiotics, it is the greatest thing since sliced bread. Okay, probiotic. I mean it, guys. Everybody should take probiotics all year round. I do. I want to be healthy. Everybody should take probiotics, okay? If your blood pressure goes up when you take, my blood pressure goes up when I talk about, Kelly, when I talk about stupidity. That's when my blood pressure goes up. Maybe I should quit talking about it. Okay. Yvonne, propylene glycol, that's in a lot of people have trouble with that. Those are used in some medications, but it's used in, you know, sort of preserving foods and things like that. Again, guys, we don't live in a perfect world. There's all sorts of things that, you know, I wish to some extent, but the food industry, they want to preserve food or put it in some meds, and some people have real trouble. Some people are, you know, like Kelly and whatever. You guys are canaries in the coal mine. Let me get another one here. So who has asked this one here? Deb, you're easily startled. That's you. I'm not. But that's you. It's your uniqueness. I'm not going to use the word weird. I'm going to use the word unique. And you got your unique fingerprint. You know, some people are hypersensitive to whatever. Somebody was asking about eggs. And from the day one, when they have eggs, they're nauseous. I think it was Evelyn asking about that. Well, that's you. Some people can't have eggs. Some people, I read an email or whatever yesterday, and I said, because the lady, she was on the reset and doing really well, and then every time she had cheese, it was bothering her. I said, stop. Don't stop the reset, but stop eating cheese. It's bothering you. Some people get bothered by that. Okay? It's your uniqueness. It's not like you can't say, well, oh, cheese is no good for you. If 99% of the population get the benefits and you don't, well, it's just you might not be able to break it down. There's something in there that, you know, it's the casein or whatever that you don't break down. Don't worry about it. That's you. Don't force the issue either. You know, if you can't digest eggs, don't eat them. You can't digest a cheese, don't eat it. You know? We got vitamin K2, which is cheese and butter. We put it in our vitamin D. You know? So, you know, I'd rather you eat it, but if you can't, and you need K2, okay? So, I don't even know how to pronounce it. I think it was Mona asking about adamini. Isn't those the little wee peas? Can you have them? Yeah, but not on the reset. But they're, you know, they probably have more protein than most vegetables. And you like that stuff? Eat it. I got no problem with it. I think it's good for you. Absolutely. No carbs. Hardly a carb in there. So it would be good. How do you pronounce it, by the way? I don't know. Edamini? Brigitte, I already answered. Kathy's asking about a supplement that promotes lymphatic drainage. Vitamin E. That's a supplement. Exercise. Nothing better for your lymphatics than exercise. Navital's good too, by the way, because opens up your blood vessels. And you get more circulation. More circulation. Lymphatics are just part of your circulatory system. It's your drainage system. But there's nothing like vitamin E. And you can do massage. You know, they do lymphatic drainage and massage. But move. Vitamin E. There's nothing better for your lymphatics than vitamin E. That's why I call it a vitamin. I got rid of the other vitamin E to do it. And Karen's asking about self-diagnosis and insulin. Karen, yes, it's better to self-diagnose. Look, if I could see your blood work, I tell you in 5 seconds. See your triglycerides, see your HDL, see your liver enzymes. I can tell you if you got insulin resistant. But we have a chart. And make sure, Karen, afterwards that you go on and we'll put that chart to you. The chart from the Martin Clinic. Early warning signs that your insulin resistant. Some of them are surprising. And for sure signs that you're insulin resistant. I mean, there's some very surprising ones in there. One of them, we talked about fatty tongue syndrome. What is fatty tongue syndrome? Sleep apnea. Okay, so sleep issues, joint problems, so it can be all, a lot of inflammation. And, it's amazing. Your insulin affects almost every area of your body. Brain fog and this kind of thing. But I'm going to do a teaching on that again. But Karen, thank you for the question. We're going to talk about some weird symptoms of insulin resistance, okay? Weird in that sense, okay? I don't want to use the word. Some people don't like weird. But I'm going to say weird symptoms of insulin that you might not even think is insulin, okay? So good question, but we'll put that chart up, okay, for you. Susanna is asking about Dr. Martin, okay? And I had a lot of, you weren't the only one, Susanna. Bone broth. Why do we use chickens instead of beef bones? Well, look. And someone was saying online this week that, chicken, Dr. Martin, you're always laughing about chicken. Well, I'm teasing. Ladies, I'm just teasing you. I mean it, but I'm teasing. Because you like chicken and salad. And I'm not saying chicken's no good for you, please. Okay? I'm teasing because you live on it. And that's why you always have trouble with your gallbladder. And that's one of the signs, by the way, you have elevated insulin, is gallbladder problems. Okay, but anyway. So Susanna is saying, well, why do we use chicken bones? Okay, well, look, we're using the bones, not chicken. It's because when you leach either out of chicken bones or beef bones, it's not that, because somebody was saying online, well, you always say, Dr. Martin, the beef is better because it's got, yeah, but that's when you're eating its meat, not the bones. The bones of chicken and the bones of a cow, I mean, they got all of the same nutrients in there, okay, and all the minerals. And when you leach that out, like, is beef broth better than chicken broth? Not nutritional, because it's the bones that you're leaching out, the bones, not the meat. The meat is different, for sure. Cow meat, in my opinion, well, it's got cholesterol, so chicken a little bit, but, the beef has more. And it has more B12, and it has more of the iron, okay? But the bones, there's not much difference, okay? Okay, not much difference. It's a good question, though, because at least Susanna, I appreciate it, because you're thinking alongside of me. And not Susanna, but Suzanne's asking about exercise-induced asthma. Listen, always go back. Asthma always starts in the gut. I know it's lungs, but it don't start in the lungs. Asthma is an allergy. Asthma is leaky gut. There's usually candida inside the lungs. Leaky gut, leaky lungs. Leaky gut, leaky sinuses. Leaky gut, leaky joints. I mean leaky gut, leaky skin. and you know, so I would start, look, make sure there's no allergens that are bothering, because usually exercise is not as much food, because sometimes it's dairy, sometimes it's and it's usually milk more than cheese or whatever. But I mean, look, you got to figure yourself out. You know, be Dr. Mom. Figure out your child. And exercise, but it still starts in the gut. So get them on probiotics, okay? Ellen's asking about flaxseed, golden or brown. I don't care. Flax seeds are great because they have lignans. And lignans blocks your your estrogen. You want to lower estrogen. Excess estrogen ain't no good for you because it's a growth hormone, and it really is a factor in cancer in men and women. Prostate for men, breasts for women, and ovarian for women, and all that estrogen. Get it down. Flax seeds are great. I love them. I even allow them on the reset because I want to get that estrogen down, okay? Pauline asking about some people, and it's true, acid reflux. No, acid reflux, remember, that is a sign that your insulin's high. That is the body going, hello, you got insulin resistance. Digestive problems, a lot of digestive problems are because your body's screaming at you that you're a carboholic and lower your insulin. But she did the reset, and they're talking about it, and they get a little bit of acid reflux afterwards. Okay, well, it's not completely fixed yet. You fixed insulin resistance, but sometimes, you know, as we get older especially, we don't make the enzymes we used to. So some people need to continue on with digestive enzymes. I take digestive enzymes every day, by the way. They really, with your complete GI, because it helps break your food down. You're going to get more nutrition from the food when you break your food down. And look, I'm a senior citizen. Okay, I really try and take care of that. But it's a good question. Janice, peripheral neuropathy, always, any kind of neuropathy, Janice, it's circulation. Even for the nerves, it's circulation. That's why diabetics have so much trouble. It's circulation. That's why I love Navitol. It increases your nitric oxide. B12 increases nitric oxide. I use the combination with peripheral neuropathy. B12 and Navitol together. And I get tremendous results. And the reset. Get your insulin down. It can be a big factor in neuropathy. Okay, good questions. Wendy's asking about resetting, emptying the liver, which it does. In the first week, you're going to empty your liver of that fat if you could do the reset. But she's saying, well, what about if you're on drugs? Well, that's different. Your liver's not your liver gets gummed up, but it's not full of fat with drugs, Wendy. It can scar your liver. Medications can damage the liver. It can be very hard. One of the hardest ones is over the counter. It's called Tylenol. It's there's more people that get hospitalized, about 200,000 a year, from liver damage from Tylenol. It can scar up. Look, and you got to take a Tylenol every once in a while, okay, or Advil once in a while. Advil's more kidneys, Tylenol's more liver. A lot of medications damage the liver. But, I'm not going to tell a person not to take their medications, but the reset helps because it does clean away the fat. See, that what happens in fat, when you got fat in the liver, fat attracts the toxins. So the reset helps for sure. But sometimes people have to take medications, so they're always, and I just tell them, well, you got to be really careful with that, okay? Good questions. Catherine, vasectomy or tubes tied, did they affect hormones? Well, yeah. Men and the vasectomy, very little, okay? Very little. It's not really so much a hormone there. Women, when you tie the tubes, yeah, for sure. But, I mean, you know, for some people, it's part of life or whatever. Your body will, you know, your body is unbelievable. It's fearfully, wonderfully made. It can adjust. It can, you know. So, yeah, sure, it affects hormones. Lucilla, amoebas. You know, how do I get rid of them? Probiotics and sometimes I love our Candida formula because that's specific for parasites, amoebas, and I mean, because those are killer, but I like the probiotics and the parasite cleanse for that, okay? You know, we're going to do a teaching on parasites. I haven't done one in a long, long time on parasites. I talk about yeast all the time, but I don't talk about parasites as much as I should, okay? Because I'm going to do some teaching on that. I'm making a note. Thank you very much, Lucilla, for that. Ralph, coffee production. And he says, you know, chemicals in coffee production. Well, there's chemical production, I guess. Look, I mean, get an organic coffee if you're worried about that, Ralph. Don't stop drinking vitamin C. It's good for you. I can show you over 100 studies that's showing coffee is good for you. Remember, it's got quercetin. It is a great antioxidant. It's anti-cancer. Coffee's anti-cancer. And it's not acidic when it gets into your gut. Okay? So, Ralph, yeah. And look, again, you have to understand me. I speak in generalities. If you can afford organic, get organic, everything. Okay, I get it. But you have to understand me. I'm not going to tell the whole world that, oh, unless it's organic, don't eat it. Okay? I won't do that. You're not going to hear me say that. Because I'm aiming at a bigger picture than that. But if you know, like Tony Jr.'s always said it, when you're on the Titanic, don't worry about the deck chairs. Don't you like that? Don't rearrange the deck chairs on the Titanic till you change course. I want you to change course and then you can, you know, rearrange the deck chairs. Like when you're worried about organic versus non-organic food, then that's rearranging the deck chairs. Like the big picture is get your stinking insulin down. Because that's what's going to kill you. Okay. Hot sauce, Evelyn was asking, and digestion. Yeah, some people can take it, some people can't. Not going to hurt you if you take it. If it doesn't kill you on the way down. You know, some people love extremely hot. I remember my father-in-law. I just sweat watching him eat some of these jalapenos and all the hot. Holy. The hotter it was, the better he liked it. And his stomach, I don't know, he seemed to be able to take it like nobody's business. I had no problem with that. And what's this last question here? Diane's asking about I can't even read my own stinking writing here. Let me see if I can find it. But she's asking about twisting of the bowel. Can happen. Let me just see. I think it was the last question here. Diane, volvulus. Volvulus. I haven't used that. I just call it twisted bowel. And that can happen. People that have chronic digestive issues, especially when they're constipated all the time, the bowel can twist. Yeah, like one of the best things, guys, probiotics. Probiotics helps to prevent that. Probiotics help the gut like nobody's business. Okay? And eat real food. Quit eating junk food. Your gut likes real food. Okay? So good question, Diane. Okay. Went way over time. And but you guys are great. We love you. Thank you so much. And we got some good teaching coming next week. So talk to you soon.